Ravens tight end Nick Boyle is out for the remainder of the season after his knee bent in a just horrific fashion last night in their game against the New England Patriots. Welcome back, everybody. I'm Dr. Brian Sutterer, and this is your #1 source for learning about the unique medical side of the world of sports. In this video, I'm going to walk you through what happened here to Nick Boyle's knee on this play after he took this low hit last night in Sunday Night Football. As always, if you enjoy learning about this unique side of sports, please consider subscribing to my channel and be sure and go follow me over on Twitter for more real-time updates and analysis. So here's the play where Nick Boyle got hurt. You can see him catch this pass, and basically he turns, plants with that left foot, and it's just horrible timing here. Certainly the low hit is what caused this injury, but right as he plants that left foot is when the defender makes contact with his thigh. And Boyle's kind of in this process as he goes here of kind of turning to go upfield. And so initially it looked like he kind of got hit from the side, but as we'll see from a different view, you can see just the severe amount of hyperextension that he's had here in his knee. From the other view here, we can see as Boyle plants, again, it's just terribly unfortunate timing. If the defender would have made contact when Boyle's leg was not planted yet, probably wouldn't have been as severe of an injury. But it's the fact that he's already on that downward momentum for that heel to make contact with the ground here when the hit comes into his thigh that causes him to basically have no choice but go into this severe hyperextension. We can see now from this angle how really it is a lot of pure hyperextension in terms of there's not much movement in the knee from inside to outside. But looking at this angle, we can see again a little bit. If the thigh is going straight up here, this is like greater than a 45, maybe a 60-degree angle of hyperextension. We can see now as Boyle kind of comes around the top here, maybe a little bit of varus deformity, meaning the knee is kind of pointing outward here, but hard to tell 100% from this angle. The big thing to highlight here really is just this severe amount of hyperextension. So flexion is whenever you activate your hamstrings and pull the heel up to your bottom, and then extension is when you straighten the leg out. Normally, your leg should be straight. That's kind of your end range extension. Occasionally, people will naturally hyperextend just maybe 5-10 degrees. But here, his leg should be straight up and down here with his femur. But he's hyperextended, like I said, maybe 45 degrees. Severe amount here that is what caused this injury. We don't have any official word of what his exact injuries were other than he's out for the season. But based on this mechanism, we can walk through the main structures and kind of talk about severity. Hopefully you guys know by now we have 4 primary knee ligaments. On the inside here is our MCL, the outside the LCL, and then deep inside we're gonna have our ACL, which runs from the anterior front portion of the tibia up to the posterior portion of the femur, and then our PCL, which is gonna run kind of opposite, the posterior portion of the tibia onto kind of that middle notch of the femur. The other thing to remember too is kind of on the whole surrounding this joint, we have something called the capsule, which kind of contains that joint space. And then of course we've got a number of different muscle attachments and other small ligaments that I don't have shown. This knee here in this position is at full extension. So if we look back here at what happened with Boyle's knee, basically swing the tibia forward and see what's gonna stretch, and that gives you a sense of what gets injured here. If we go back then to the anatomy here, if you imagine taking this lower portion of the leg and pulling it forward while we anchor the femur, you can guess what one of the most common structures is to injure here. The PCL. Between the PCL and the ACL, it's conflicting evidence in terms of which one is gonna go first in a hyperextension injury. Usually when there's a combination of valgus or varus positioning of the knee is when we're gonna see that ACL happen more often, as opposed to just a pure straight on hyperextension, you're gonna see that PCL go. When they've done research studies looking at cadaver legs where they basically just put them in pure hyperextension, around 30 degrees seems to be a crucial mark at which point you can injure the PCL and the ACL. And we can see here Boyle is clearly beyond that position. It's certainly likely he's injured these other ligaments in his knee as well, because again, rarely are these purely in one plane of motion. There's gonna be some side-to-side movement here, which is gonna stress these other structures. It's gonna stress the meniscus. It's gonna tear that capsule. It's gonna cause bone bruising. And so there's a whole other host of injuries on top of just the ligament damage. A key thing to know though, when covering these games and seeing an injury like this as a medical provider is knowing if someone has a knee dislocation. A knee dislocation is gonna be a very urgent, get into the emergency room as quickly as possible to prevent blood flow from being compromised down to the lower leg. For a knee dislocation, you need to have 3 out of the 4 primary ligaments torn to allow for enough instability for the joint to dislocate. And that can really be any combination. It can be the ACL, the PCL, and one of these lateral ligaments, or it could be the MCL, the PCL, and the ACL. It can be really any combination, but 3 of the 4 is what you have to remember for a knee dislocation. Now, in the year of Alex Smith returning to the Redskins, I want to say anything is possible in terms of guys coming back from terrible injuries. Assuming he's got no damage to the blood flow, no damage to the nerves, and the surgeries go well, then rehab can certainly get him back to playing, but it's of course going to be extremely difficult. What's so unfortunate about this is, like I said, the positioning here and the timing is just horrible luck. Because when Boyle plants his foot, it's so far out ahead of his body, when the defender's momentum comes in, it's going to be hard for it to kind of push the leg backwards. Also, that timing is perfect, that he plants right as that load comes in, and so his foot is anchored into the ground and can't move. If his foot were up in the air, then you have more of an open chain sort of position to where the foot can move, and some of that impact from the defender pushes the foot back instead of anchoring it to the ground. The fact that the foot gets anchored to the ground here is what causes that hyperextension. If this is a split-second difference, if the defender comes in a little bit higher, even honestly, if he comes in a little bit lower and hits below the knee, it's probably not going to be as severe. So terrible timing, but kind of the way it is in these sports. That's it for the video though, everybody. Thank you as always for watching, and I hope you learned something. Let me know any questions or comments down below. And until next time, we'll see you later. Bye.